Now, there may be a part of you, a little voice in the back of your head that is saying, but why should I worry? I can just go to the doctor. All of this preparation, it sounds like a lot of work. Nobody else does it. Why all the fuss? Well, let's think about that. Do we really want to sit in a waiting room full of sniffly, contagious people, perhaps late hours of the night or wee hours of the morning, waiting to get some costly medications because our bodies were actually too sick to fight off garden variety germs that come around every year? Wouldn't it be better to have a body that could resist getting sick, and if we did start to get sick, could vigorously fight it off and be well? This is the way our bodies are supposed to work. Wouldn't that be better? In addition to that, there are some serious problems with the drugs that we use all the time. Did you know that the commonly used antibiotics have warnings? And it's not just a few of them, it's all of them. Antibiotics, by their very nature, can cause side effects. Doctors and scientists have been warning us, not for years, but for decades, that we have been using antibiotics too often for too many things. We are creating superbugs, bacteria that are resistant to any of the antibiotics that we have. We keep inventing new ones, and that is getting more and more difficult. When we actually get into a situation where we desperately need antibiotics and that they would be a life-saving medical intervention, those antibiotics don't always work because we have overused them. Cipro is currently in the news as they've been making more of the side effects known, but it's simply one example. Some of the side effects of Cipro can be severe stomach pain and diarrhea that is watery or even bloody, headaches, heart pounding, muscle pain or weakness, even convulsions. Antibiotics can also cause rupture of tendons, which is when the connection from a muscle to a bone simply snaps and the muscle is no longer connected and is no longer functional. It can cause nerve symptoms, burning pain in the skin, sensitivity to the lightest touch, even changes in your brain, in mood or behavior. Imagine you go in to take care of a cough, you take an antibiotic, and you end up with depression, anxiety, or hallucinations. Antibiotics can cause serious toxicity to the liver. They can give you all kinds of symptoms, ringing in the ears, which can be permanent. Many of these symptoms can be permanent, and I have seen many of them in my practice. Even the most common ones that I see are usually skin reactions. Again, you go in for a cough, you're feeling lousy, and you get a rash all over your face that peels off and is worse than the disease. We should always think twice before we take antibiotics. Save them for truly serious situations. Sometimes the cure is worse than the disease. One thing that happens frequently nowadays is that people are overtreated for viruses, which are completely unaffected by antibiotics, but they are given as just sort of a prevention in case a bacteria might be involved. And all of the gut flora are effectively suppressed or destroyed, and microorganisms that are normally not pathogenic become extremely dangerous. One of these is Clostridium difficile, which is called C. diff, and normally exists just like a pathetic little germ tucked in the corner of your colon, but when those antibiotics are in there and they kill off everything else, all of the bacteria that live in your colon that are on your side, all of a sudden C. diff emerges and it can be life-threatening. I've seen this happen. And what about the other component that we often take for just flu or bronchitis or garden variety diseases? The steroid shot, the other component of the Z-Pack. Steroid shots are basically cortisone, prednisone steroids. We've heard about those. They're not supposed to be good for athletes. Why are we taking them for ourselves? Cortisone is a steroid drug most commonly used. This drug works by stopping inflammation. That makes you more comfortable because inflammation is part of the body's immune response and it's uncomfortable. But cortisone also stops your body from having an immune response. Now think about this. You take an antibiotic to kill bacteria and buy some time for your own immune system to step up its own defenses and finish the job. There's no antibiotic that's going to kill every single germ in your body. But you buy time for your own immune system to do it. But then if you combine an antibiotic with a steroid, you're effectively stopping the immune response completely. It makes no sense. It is purely for convenience, but it is not in our best interest most of the time. Cortisone has many side effects. The allergic reactions can be severe, again, skin rashes, itching, hives and swelling, heart problems, high blood pressure that is fluctuating and unpredictable, muscle problems, and when you use steroids over a period of time, repeatedly or long term, they simply stop your metabolism from repairing your tissues, including your bones. So you get actually weaker in those areas. These are serious side effects. You can get stomach problems from steroids, and that is because the stomach has to repair itself constantly. It's a tissue that repairs itself every day. And when you take a high level of steroids, your stomach can't repair itself because that metabolic process is simply turned off by the drug. Pancreatitis can occur. It's rare, fortunately, but it can be fatal. If children use antibiotics and steroids frequently, they can have slowed growth and development. It can affect just every developmental milestone they have, and the results are insidious. You never look at one dose and say, oh, this is what made little Johnny have to stay back a grade. No, it's a subtle kind of process. Sometimes the cure is worse than the disease. In this picture, we see a child who has had to be on steroids, and we see the very swollen, round moon face and the irritated skin, the dull look in the eyes. And this is not a happy, healthy baby. Sometimes these meds are necessary, but most of the time they are not, and they are not the best way to achieve health.